What is the procedure for cleaning the uterus after a miscarriage?
Hello everyone. Today we will be discussing a sensitive and important topic, the procedure for cleaning the uterus after a miscarriage. Miscarriage is a traumatic event, both physically and emotionally, and it's crucial to ensure your body recovers appropriately. Our focus in this video will be on the medical procedures and at-home care to ensure a healthy recovery.
What happens after a miscarriage?
After a miscarriage, the body usually expels the pregnancy tissue on its own. This process may take a few days to a few weeks. It's essential to consult a healthcare provider to monitor this process and to ensure no complications arise.
When is a medical procedure necessary?
In some cases, not all of the pregnancy tissue may be expelled naturally. When this happens, a medical procedure may be necessary. Dilation and curettage, also known as D&C, is a commonly performed procedure. This involves dilating the cervix and removing the remaining tissue from the uterus.
What is the D&C procedure?
During a D&C, the doctor will dilate the cervix and then use a surgical instrument to scrape the uterine lining. This is done under general or local anesthesia. The procedure itself usually takes around 15 to 30 minutes, but the recovery time may take a few hours to a few days.
What is the aftercare following a D&C procedure?
Following the procedure, you may experience some side effects such as cramping or light bleeding. Over-the-counter pain medication and rest are often recommended. If you experience severe pain, heavy bleeding, or fever, contact your healthcare provider immediately.
What are some natural methods for recovery?
In addition to medical procedures, there are also ways you can help your body recover naturally at home. Eating a balanced diet, staying hydrated, and getting plenty of rest can aid recovery. Emotional support is also vital in this process, and you should seek professional help if needed. In conclusion, the body typically cleanses the uterus naturally after a miscarriage, but in some instances, medical intervention may be necessary. Always remember to consult with your healthcare provider about the best course of action for your situation. It's essential to take care of both your physical and emotional health during this difficult time. We hope this video has been informative and helpful. Please take care.